But I think the insight has to be around consent and around the absolute non-negotiable concept of consent, that sex must be between two consenting people.
All right, if you could teach the world one essential insight about sexual health, something that really moves the needle, what would that be?
Oh, that's a $1 million question. So I don't have the perfect answer for that, but I think the insight that is a global insight. And I have a sort of serious one. I mean, one of my missions is to close the gendered health gap and to have women claim sexual pleasure for themselves. So that is one mission. But I think the insight has to be around consent and around the absolute non-negotiable concept of consent, that sex must be between two consenting people, not one consenting person. So it's not the happiest, most joyous topic, but as someone who has seen assault and non-consensual relations and the fallout from that for 30 years and seen that all over the world, I dream and pray that that could become just a universally accepted truth.
Oh, absolutely. And we talk a lot at Sexual Health Alliance about enthusiastic consent. So it's not just like not saying no, it's giving a strong, enthusiastic yes throughout the entire experience.
Right, exactly. And it's different. And so many women suffer, I think, sociocultural norms that imply that consent is optional or not even needed. So, again, globally, I think that's where to move a needle really forward would be to just conquer those long standing beliefs that, at least in heterosexual couples, often that sex is for men and that they don't need consent. So, it's a big, heavy topic, but it's important.
Yeah, 100%. All right. Now at Sexual Health Alliance, we train many people who want to work in the sexual health space. So, what's the most important thing that professionals need to know?
Well, I think they need to know how to be good listeners and to meet people where they are, to meet their clients and their patients where they are. I heard the most frustrating thing yesterday. I did an event in New York, a round circle event where women shared some of their biggest frustrations about menopause, and I was surprised how many were sexual in nature. Well, not that surprised anymore. That's why I'm doing what I'm doing.
Yeah.
But a number of women told about professional experiences that left them feeling very dismissed, where within seconds of beginning to share something intimate or difficult, they were sort of interrupted and like, well, you probably just need this prescription, and I think so many clinicians, maybe not sexual health therapy professionals, but certainly in my world, doctors, they're sort of time pressed, they're burnt out, they're eager to just treat something, and they either dismiss or with their body language they imply they don't really have the time or interest. So I think professionals need to, first of all, obviously cultural context and cues, not put everybody in the same box, not ever assume that because someone is, oh gosh, there's so many assumptions, right?
Yeah.
That if someone's autistic, they're not sexually active. If someone's heavy, they must be lazy and have no willpower. I mean, we could go on and on.
Yeah.
And I wish professionals were better than that. But studies have shown time and again that professionals sort of prejudge someone and then just try to get a pat answer. And I think we need to be more nuanced in our approach.
Absolutely. That's great advice.